Hello friends. Today I'll be talking on this 43rd COVID update. As I had mentioned last time, we had spoken about Covishield in the 41st update. Today I'll be talking about Covaxin. India will be launching this Covaxin on 16th of Jan 2020. So, I'm sure everyone would wish to know as to how this vaccine would work. I'm sure you would have heard a lot about this vaccine. But what I would do today is to take you through this phase 2 trials, which is a preprint manuscript which has come out on 20th December 2020. So it is in phase 3 trial, but it is important to understand what were the findings in the phase 2 trial and try to understand the whole concept of this Covaxin that we have in place. This is the title of the article: Safety and Immunogenicity Clinical Trial of an Inactivated SARS-CoV-2 Vaccine Phase 2 Double-Blind Randomized Controlled Trial and the persistence of immune response from a phase 1 follow-up. So what they really did in this article is that they have reported the follow-up of the patients who were immunized in the phase 1 as well at the end of 3 months. To be precise, day 104 they followed up and they presented the findings in this paper. So as you see, the authors of this paper, you have Dr. Balram Bhargava, who is the ICMR chief, and then you have Krishna Yella, who is the main person behind Bharat Biotech. So we'll just take you through the whole concept of this. The background of this particular Covaxin, we'll call it as Covaxin for understanding the whole thing, is the virus was isolated from the infected patients. So the patients who were infected with COVID, the virus was isolated, and this virus was sequenced by ICMR. So Indian Council of Medical Research sequenced this virus, and then this was given to Bharat Biotech for them to work on the vaccine. So that was the collaboration between Bharat Biotech and the ICMR. And this particular virus was NIV 2020-770, and it had a D614G mutation. So the explanation for that is there was an aspartic acid to glycine shift at amino acid position 614. So this is the spike protein. So there was a mutation with the change of this aspartic acid to glycine at amino acid position 614. So that was the description of the virion that they worked with in producing the vaccine. And as I said, this virus was sequenced in ICMR and then presented to Bharat Biotech. So the preclinical safety of this Covaxin was tested in hamsters and rabbits, and this was to ascertain the appropriate safety of this particular vaccine. So the preclinical studies was done in animals. So that is also something important for us to note. And so the way they went about creating this vaccine is they took this toll-like receptor 7-8 agonist molecule and they got it adsorbed into an alum. So alum is a sort of a binding sort of a substance, so to which this toll-like receptor agonist molecule was adsorbed, and it produced a molecule called Algel IMDG. So this was the nomenclature they used for the vaccine through their study called Algel IMDG. So if you look at the coronavirus in a schematic representation, so it has various elements or proteins against which antibodies could be produced. So as you see the red one, so these are the spike proteins, and these are known to cause the virulence of this virus. And most of the targeted antibodies are against this spike protein. Then you have this receptor binding domain, which also against which also antibodies are produced. Then you have a surface sort of a protein, then you have a lipid core, and this round one that you see inside is the nucleocapsid. So there are antibodies which could be produced against any of these proteins, but the commonest one that the vaccines are made to be targeted are against this spike protein, which seems to be the most virulent aspect of this virus. So as we have understood from the previous two talks that I gave on vaccine, so the Covaxin is a inactivated virus. So which means the virus is not alive, so it can be a dead and it is inactivated virus, but it has ability to invoke immune response from the host into which it is injected. And the inactivation of this virus by Bharat Biotech was done by propionic acid. So they used propionic acid to inactivate the virus. And the Covaxin, once it is produced, it has to be stored at 2 to 8 degrees. So that was the requirement or prerequisite for maintaining the potency of Covaxin. So the phase 2 trial was done with 3 doses of Covaxin. They used 3 micrograms and 6 micrograms. So these are the 2 doses they used in the trial, and they used this at day 0 and day 28. So the aim of the phase 2 trial was to look at the immunogenicity and safety of this Covaxin. And once this vaccine was administered, they checked for antibodies, IgG titers against the spike protein. So this is the spike protein, and they looked at the production of antibodies against the receptor binding domain, which I showed you in the previous figure. And they looked at antibodies against the nucleocapsid. So basically, it's a good study where they have looked into antibody titers against all these 3 proteins in the COVID virus, and they did an ELISA test to determine these antibody titers, and they measured the titers as GMT, which is called geometric mean titers. So they estimated geometric mean titers of the antibodies against spike protein, receptor binding domain, and nucleocapsid. So, and in addition to that, so they did look into cell mediated response in 3 sites. At day 42 and day 56, they looked at cell mediated response. So there were 2 cell-mediated response they looked into, the Th1 cells and Th2 cells. So, and these Th1 and Th2 cells typically produce a lot of cytokines. As you see, the Th1 produces interleukin 2, interferon gamma, tumor necrosis factor, and interleukin 3. And Th2 produces all these other interleukins, interleukin 5, interleukin 6, 9, 10, 13. So, along with this, they measured the peripheral blood mononuclear cells to look at the T helper cells, and they looked at 2 types of helper cells. One is CD45 RO plus and the other one is CD45 RO27. So these are the 2 helper cells they looked in peripheral blood mononuclear cell assay. So which means it was a very comprehensive study where they looked at antibody titers against the spike protein, receptor binding domain, and they looked at nucleocapsid. Along with it, they looked into Th1 and Th2 cell response with regards to humoral response and the cytokines they produce, and then they even looked at helper cells or the memory cells in the circulation. So in that sense, it was a good study to look into all these components, whether there was a good immune response. So the methods, so this was a double-blind, randomized, multicentric study done across 11 hospitals in 9 states in India. And this is a phase 2 randomized control trial. They had 380 patients, 190 in one group which got 3 micrograms, and there were 190 patients who got 6 micrograms of this vaccine. And the age group they took was more than 12 years and less than 65. So this is another point that I wish to emphasize. So if you look at the Covishield vaccine, so again here 86% of the patients in Covishield vaccine trial, they used patients less than 55 years. And even if you look at this study, so they have taken only patients less than 65. But our whole narrative of vaccine is to protect the vulnerable patients, and we know the COVID affects elderly people more severely, and our whole effort and intent is to protect this elderly population who are more than 65 years. But now with these trials excluding this age group, so it makes me really wonder how how this vaccine would really manifest in these elderly vulnerable patients, because both these trials seems to have excluded the patients above 65. So that is something which is a limitation of these 2 studies. So I'll have to see if phase 3 trial at least they have included elderly population. So the primary outcome was to look at seroconversion, and this was defined as more than or equal to 4-fold increase in the titers of the antibody. So that was the primary endpoint. And the secondary outcome was to look at the reactogenicity and safety of this vaccine. And as I said, the phase 1 patients who were administered vaccine were followed until 104 days, that is 3 months after second dose, and they looked at the antibody titers and the seroconversion if it prevailed until 3 months. So this was also another endpoint that they looked into in this particular study. So let's look into the results. So they had 380 patients, as I said, 190 in 3 microgram, 190 in 6 microgram. They looked at seroconversion, which is 4-fold increase in the rise of titers at day 56. And if you see, the seroconversion was pretty good at 92.9%. It was 98.3%, which means there was no remarkable difference between low dose and 6 microgram. But if you compare head to head with our Covishield, where they use low dose and standard dose. We saw in the previous narrative that the low dose vaccine uh, produced much bigger sort of a efficacy rate when compared to the standard dose. But in this particular Covaxin, there was no such evident difference between the low dose or the 3 microgram and 6 micrograms. So again, this is a stark difference between Covishield and this what we could recognize. And they looked at systemic adverse events, and as you see, there's no much difference between 3 micrograms and 6 microgram. And these systemic adverse events were all not of very severe nature. Predominantly, they had fever, headache, fatigue, or pain or stiffness at the injection site. So these were all the systemic adverse events. They did look at any life-threatening serious adverse events, and this is a good point about this particular vaccine. It was nil between these 3 micrograms or 6 micrograms. There was no serious adverse events. And the seroconversion of phase 1 patients, they followed till day 104, which is at the end of 3 months, and they found the seroconversion prevailed in 73.5% of the patients in 3 micrograms and 73, which means at the end of 3 months we know that they had a good seroconversion or good antibody titers to confer protection against COVID. So that is also something we could derive at the end of 3 months from this particular study. And what they also noticed was Th1 response, which is tumor necrosis factor alpha, interferon gamma, and interleukin 2, 3 producing cells were greater than Th2 response. So that is another finding in this study, that Th1 cells producing these cytokines were more evident than Th2 producing cytokines. So if you look at the tables from the manuscript, so these were the institutes, 11 institutes that were included in India. As you see, there is All India Institute of Medical Sciences, Delhi. There is a Nizam's Institute, Hyderabad. Then there is All India Institute of Medical Sciences from Patna as well. So these were the centers that were involved. And this is the geometric mean titers against the spike protein. As you see at that, there is a linear increase in the antibodies against the spike protein from day 0 to day 28 to day 42 to day 56, which is again a good thing. So there is a linear increase in the titers of the antibodies after the administration of vaccine, and this is the receptor binding domain protein antibodies. Again, there also you see a sequential increase in the presence of antibodies against this. And then you have a nucleocapsid protein. Even there you see a good levels of antibodies against that. So these are something that is also very compelling for us to believe that this vaccine is very effective. So this is a pictorial representation of the vaccine of the antibody titers for 3 micrograms, and 3 micrograms is indicated in green and 6 micrograms is indicated in blue. So they did something called plate reduction neutralizing test, and they found the antibody titers were comparable between these two groups. And they did a micro neutralizing titers as well, and as you see, between 3 and 6 microgram there is no remarkable difference, and there is a linear rise in the titers until day 56. So the follow-up was done until day 56, and they found good antibody titers with both these tests, plate reduction neutralizing and micro neutralizing titers. And so this was again comparing between the phase 1 group and the phase 2 group. So they looked at the titers at day 42 and day 56 from the phase 1 patients and phase 2, and they found similarity and increase in the titers from day 42 to day 56, and that was statistically significant, as you see, which means to say there is a consistent linear increase of these titers, and there has not been a huge discrepancy between the phase 1 findings and the phase 2 findings, and there has been a linear increase which was significant. And this is the cell mediated response, which again they have shown. So this is the pre-vaccination, the brown one, and the green and the blue one is the cell mediated response you see with 3 micrograms and 6 micrograms, and which again shows there is a good production of this interferon or interleukins from these Th1 and Th2 cells in vaccinated patients. And this is, they have even gone on to measure the sort of a humoral immunity or the cytokine production from the Th1 and Th2. As I said, the Th1 response was more profound than Th2. So the Th1 cells typically produce tumor necrosis factor and interferon gamma. So the blue one is the interferon gamma levels. As you see, it was significantly high when compared to the pre-vaccination where there was no interferon gamma levels, and TNF levels also significantly go up when compared to the pre-vaccination findings. And this is the memory T cells. So if you look at the pre-vaccination memory T cells and post-vaccination with 3 micrograms and 6 microgram, it was statistically significant. There was a significant increase in the memory cells or the CD4 CD4 sort of a cells which are needed for the immune memory, what we say, or the memory cells, and they had shown significant increase compared from the pre-vaccination to the post-vaccination. So all in all, so basically what this study showed is the seroconversion was very good at the end of day 56 in patients who were vaccinated, and there were good antibody titers against the spike protein, there were good antibody titers against the receptor binding domain, there were good antibody titers against the nucleocapsid protein, and they also showed at the end of 106 days, at the end of 3 months, the phase 1 patients who were followed up, the seroconversion remained at around 73%, and the seroconversion at the end of day 56 was close to 93 to 98%, and there was no significant difference between the 3 microgram and 6 microgram. So what I understand is in phase 3, I believe they're going ahead with 6 microgram as the dosage of the vaccine. So that is the gist of this whole phase 2 trial. And what we also have taken comfort is there is no serious adverse events in 3 microgram group or 6 micrograms, and they had systemic adverse events which were typical to any of the vaccines. So all in all, so a very good study which has looked into various dimensions of vaccination and how the immune response has been. And the good thing about this particular vaccine is there are antibodies produced against various proteins of the virus when you compare it to the Covishield, where predominantly we have put in a genetic material to code for the spike protein. So basically there are antibodies you would expect or seroconversions only against the spike protein and may not necessarily capture the other receptor binding domain or nucleocapsid or the surface protein. So all in all, Covaxin seems to be more compelling vaccine, and I would be very hopeful that even phase 3 trials would be very, very positive, and it may confer a good sort of a protection against the COVID. So thank you very much. So I would end this with this quote. So those who cannot change their minds cannot change anything. So you can visit my website www.drpradeeprangappa.com to rehear to this lecture and gain some clarity, and you can contact me if there is any other suggestions that needs to be made on this. So thank you all.